You know, possibly the worst thing that can happen to a runner is an injury in the build-up to the Comrades. Not only is there a physical problem, but the mental effect can be vast. But there are ways out of this, and one of them is to go to a physiotherapist. I'm with Gary, a physiotherapist in Johannesburg, who's going to take us through some of the injuries.
One can look at two specific groups of injuries. First of all, there's the novice runner, whose muscles and bones haven't quite adapted to the stresses of long-distance running. And they tend to pick up overuse type injuries. The most common injury that we see is the iliotibial band friction syndrome, or the well-known ITB strain. And this is where the runner gets pain on the outside of the knee. And walking downstairs is particularly painful, running down hills, and towards the end of the race one would pick up this pain. The second most common injury is the runner's knee, which presents with pain around the kneecap area. And this is so commonly seen in runners that it's called runner's knee. The third beginner injury that we see is the classical shin splint, which is pain down the inside of the leg, and once again due to overuse and rolling inwards, the pronating action. And very often the novice only has to complete the Comrades Marathon in 11 hours, may not need to do nearly as much training as the more experienced runner. The more experienced runner would be doing a lot harder training and a lot of speed sessions and a lot of hill work. And he picks up with a second kind of injury, more the chronic muscle pull or the chronic muscle tear. In particular, the Achilles tendon and the calf muscle and the hamstring muscle and the hamstring tendon. What we do is we treat the actual symptoms, treating the pain and promoting healing with all the modalities that we use. But as important when it comes to sporting injuries, one needs to actually look at the cause of the injury. And that often is due to incorrect training procedures, or overuse, or bad shoes, incorrect biomechanics. And often we would be involved in showing the patient the correct stretching exercise, or giving the patient the correct strengthening exercise, looking at their training program, seeing where they've gone wrong, and looking at the wear pattern of the shoe and deciding which shoe they would need to suit their foot.
So how do you handle the mental aspect of a runner coming in who says, it's the end of my world, I can't run Comrades because I'm injured?
Towards the end of Comrades at this stage, we're treating a lot of psychological problems. The runner is running Comrades, is not running Comrades, he is running, is not running. My advice at this stage is to relax and to look at your program, see what you've done. And very often a patient would have their best Comrades in the year that they are forced to cut down on their training due to an injury. So one would need to not overdo the training at this stage and try and get a goal that they would find is comfortable for them.
Well, some words of wisdom there from Gary, physiotherapist. So the message is, all is not lost in the build-up to Comrades, but you haven't got much time. See you next time.